So what do you do if you're a trans feminine patient who wants top surgery, but you don't want to deal with these? The thoughts of having implants really doesn't vibe well with you. Is there another way? So the short answer is yes. We do have another technique to enhance the breasts, but you don't hear about it very often. And in this video, I'm going to talk about why a lot of patients don't end up going for this. So the alternative would be fat grafting. And so I never knew this existed before I became a doctor, but it's pretty awesome. We're able to take fat from where we don't want it in the body, we liposuction it out, we process that fat, clean it, and then we can inject it back into wherever we want it. So probably the most common place it's injected in the United States is in the buttocks. So that is your Brazilian butt lift. But it can also be used for the breasts. And this is very nice because you don't have any implants, so it's all your own tissue, and it's pretty safe. It's very safe, and it's a win-win situation. We take the fat where we don't want it and put it where we do. And so the reason that most of the top surgeries, the vast majority of the top surgeries I still do is with these guys, it's for a couple of reasons actually. So number one, when we take out these fat cells, they're still alive and we put them back in, it's a graft. So those little fat cells have to find their new home in the breast and grow in their blood supply and stay alive in order to stay in your body. And so that means that it's like planting seeds in the soil. There's only a certain amount of soil that's there, so you can't stuff endless amount of seeds in there. So there's only a certain amount of fat grafting we can do at one time. If we keep trying to put fat in there, all the excess fat we put in is just going to die and it's no use. So at a certain point we inject as much as we can, and we have to stop because we can't fit any more in there right now. Now, you could come back once everything is settled in there, because now it's settled, that tissue is alive and it's all soil, so you have more soil available, so you could put more in at a second time. But these surgeries aren't cheap, it's downtime, it's general anesthetic, and so a lot of patients don't have the time or money to do multiple rounds. The other thing that's very disappointing about fat grafting is you usually lose between 20 and 50% of those seeds you put in, or fat cells don't actually take. And so initially we can have a beautiful set of full breasts, but we're going to lose up to half of that. So it can be a little bit disappointing. And again, multiple surgeries may be needed. And realistically, I say to most patients, depending on how much tissue you have there in the first place, with fat grafting, you're really not going to upsize more than maybe a cup or so. And even at that, it can be unpredictable. Whereas if we look at this bad boy here is, let me see, well, that's only 400. This is probably a pretty average size we put in patients in the United States. In these devices, there's a lot more volume. And so we get that instant gratification, and there's no question you have done a surgery, so you can't miss it. Whereas with the fat grafting, it's a lot more subtle. The downtime with this procedure is probably easier as well in most cases, as we don't have the donor site or where we did the liposuction, which usually has a little bit more downtime than these guys, depending on the technique we use when we put those in. So therefore, fat grafting, it's a really nice option, but the reason we don't see folks doing it much is because oftentimes multiple surgeries are needed, and it can be quite frustrating because the reason we're doing this surgery is to go bigger, and really with these guys we're definitely going to get that. You're not going to miss the fact that we put the implant in, whereas with the fat grafting we're going to lose some, and it's a much more subtle enhancement. If you want more information about this, shameless plug, this is my book, Affirmed, published about 2 years ago now. Myself and 9 other experts in the field published that, and it's available on Amazon. So I hope this helps, and thank you for watching.